I'm Lou Weckstein, and I'm the Medical and IVF Director at RSC. I've been working in the infertility field for 20 years now, and I would say there have been a lot of changes, but probably the biggest are the development of ICSI, which is a treatment for very low sperm counts or motilities. And this treatment has allowed men who would have not had any possibility of achieving a pregnancy with their own sperm to have a successful pregnancy. So ICSI has been one of the biggest, and the other is the development of what is called blastocyst culture, which is allowing embryos to grow in the laboratory more days. And as they develop more and more days, it's easier for us to select the best embryos, the ones that are going to be most likely to result in a successful pregnancy. And by doing this, we've increased success rates, and we've also reduced the multiple pregnancy rates, because by going to the blastocyst stage, we can limit the transfer to only 2 embryos, and therefore really reducing the chance of anything more than twins. What are the traits that I would most like patients to know about me? I love what I do. I come to work every day. I'm thankful that I'm working in a field that is so exciting and gratifying. I think being very excited about what I do helps me to be a very effective and successful doctor. I think I'm a very empathetic person. I think I can really understand what patients are going through, and I really try to be very personal when working with patients. I always get back to patients, call them whenever they call and have questions. So I guess the message that I would like to put out there is I'm a doctor who really cares about you, and I'm going to do everything I can to help you succeed. The most important message that I could give to people who are trying to get pregnant and struggling with infertility or considering IVF is not to give up, because if you're persistent, we can ultimately help you to realize your dreams and to have a baby and have a family. With one treatment or another, the chances of you ultimately succeeding is very, very high. On somewhat of a little bit more of a negative note, when considering infertility and IVF treatment, it's very important to keep in mind female age. And I think that we in the infertility field need to get the message out better to the general public that female age and infertility are strongly connected, and that women need to be very concerned about their fertility as they get into their mid-30s, and they should come in for a prompt evaluation and treatment because time and age is one of the biggest things that they're up against. The most rewarding part of my job, I think, is helping people to have babies, helping people to have families. And one of the best times is when I get to call people who come in for their pregnancy tests with a positive pregnancy test. It's also great when couples come in for their first ultrasound once they're pregnant, and they get to see on the screen the baby and the heartbeat. And those are certainly very, very exciting and rewarding times for all of us. What is the best thing about RSC? I've been working at RSC for 17 years, and I think it's the people. I think it's the doctors, the nurses, all the staff, because we're all part of a significant team that is very important to your treatment and care. And you certainly want to have treatment in a center where everybody is working together to try to help you to succeed. And I really love coming to work every day and working with the people who I work with. The most common question that I get asked, I would say, every day is, am I going to get pregnant with your treatment? And you know, I certainly tell everybody, I can't tell you that for sure, but I can tell you we want to give you a realistic idea about what your chances are with different treatments. And certainly I can tell you that if you're persistent with one treatment or another, the chance of you succeeding is going to be very high.